It's all yours, ma'am.
Okay, I'm going to call the meeting to order. It is 5:35 on Wednesday, March 3rd. We will begin our meeting for the Laredo Webb County Drug and Alcohol Commission. The first is a roster roll call. So as I mentioned, it is myself, Mr. Hernandez, Mr. Leal, Ms. Mendez, Mr. Montemayor representing the commission. And then we have Ms. Moreno as our guest. And then we have Mr. Walls and Ms. Paola as representatives for the city of Laredo. If I missed anybody, could you please let me know? Okay, if I have not, we're going to go ahead and continue with public comments. Did anybody sign up for public comments, Mr. Walls?
Not that I know of. Paola, do you have any?
No, there's none.
There's none, ma'am.
Okay, thank you very much. And as a matter of fact, I want to be able to introduce Ms. Velez, who is now taking the role of Andrea. She will be assisting with our meeting and minutes, and then we'll hopefully be able to send something to Andrea. I had already spoken to her, and I discussed that we would miss her, but we hope that Ms. Velez would be able to do a great job as well. So welcome on board, Ms. Velez.
Thank you.
Hello, how are you?
Good, thank you. I can see the three of you, not everybody, but I'm familiarized with faces, almost.
Well, welcome on board. We're going to go ahead and move on to the approval of minutes for February 3rd, 2021. They were sent out earlier today by Andrea. Will you please review them if you haven't? And if not, can I please take a motion to accept?
Motion to approve.
I have a first by Ms. Mendez. Do I have a second? Do I have a second to approve the minutes?
You got a second, yes.
Was that Mr. Hernandez? Okay, Mr. Hernandez, thank you very much. Any question, any comment? If not, do I have a motion to approve the minutes as written? Do I have a motion to say aye? Approval?
Aye.
Perfect, thank you. Any opposed? Motion carries. Minutes are approved as written. Moving on to the discussion and possible action on several subtopics, including the update on the detox facility. Mr. Walls, I know that there was a meeting on February 16th. Can you give us an update on that, please?
Yeah, the city council meeting happened on February 16th, and the drug rehab agency went ahead and made its presentation. If anybody wants to see it, it is video recorded in the archives there of the city council. Just a little bit of background on the drug rehab agency. They've been working in the business for about 10 years, and they've helped open over 30 treatment centers at all levels of care, including detox. They've worked in 10 states, including Texas, and they specialize in licensing, accreditation, risk management, operational, and strategic planning. So, you know, that we have a consulting group that is very familiar with what they are doing.
Yeah, I saw bits of that, and I'm very impressed with their knowledge because, I have licensed sites, and it's a lot of work. It's a full-time job, and I had to do that when I was a deputy director of treatment or program director, and it's a full-time job. And you have to be knowledgeable. I had to learn as I go, but it's always better to have consultants that can do all of this because it takes so much work. So the idea is that while we're building it, they're going to be also looking at the way the facility is, but they're going to be able to help us with the licensing and the protocols that are required by the state. So I think that that's a really good thing. I think it's, that way it's almost like the house is being built and we're just going to be able to move in.
Right.
So we just need to figure out, okay, let's get the staff ready and who's going to be doing the actual services, and then get those trainings done. And so I think that's a wonderful, like a turnkey operation. That's the way I envisioned it. Is that right, Guillermo?
Yeah, no, that's exactly it. And what they're doing right now is they're developing human resource documents, clinical documents and protocols, billing mechanisms and procedures. They're also going to create and submit the actual licensing application with the state of Texas. That way, they've already made contact with those partners up there. So we're very optimistic that we're not going to have any issues getting that license. And of course, once the facility does open, which will be late in the summer or early in the fall of this year, they will initiate the process for accreditation by the Joint Commission. And
Right.
that
And
will,
the way that process works, you actually have to start, you have to start seeing some clients and have some records. And you know, then the accreditation process starts. And I think we'll get through that without any problem. You know, as long as we train the staff appropriately, and whatever agency is going to do that, you know, I'm sure there's not going to be a problem. So that's wonderful.
yeah, I'm sorry. Marina was, I guess, giving us a little bit of feedback there, so I went ahead and muted her. But no, absolutely, Jesse, you're completely on the right track there. That's exactly why the city of Laredo did hire the drug rehab agency. You know, they're extremely professional, very you know, very good partners to have in this, and so we're really lucky to have them. That's all I have for my report, man.
Thank you very much. I know that I did see Dr. Marte Martinez the following day come out on KGNS with a report regarding that and his support to the detox facility. So it was good to see him on there. But thank you, Mr. Walls, for your update on that. At this point, do we have any work group reports from any of the groups? And then what I'm going to do is actually I'm going to send out a friendly reminder on the groups that we currently have. And then if there are any changes to those groups, we'll be happy to make them. And hopefully we'll be able to start working, whether it be through Zoom or GoToMeeting or WebEx, to trying to see if we can try to regain a little bit of more of activity despite the COVID situation. I know that we have several groups, including prevention, outreach, education, intervention, treatment, rehabilitation, detox, transitional support, and transition and aftercare. So in essence, what Mr. Hernandez is going to be providing to us is going to be part of a educational presentation for us so that we can learn more and maybe continue to strive and strive for our mission. So I'll go ahead and send out the last update to the work groups, and then if there are any changes, we'll go ahead and make them. Right now, moving forward to stakeholder agency updates. Do we have any stakeholders present currently? Let me see.
Hi, good afternoon. Yes, this is Ana Guerrero, and I am a stakeholder for City of Laredo Health Department.
Hi, Anna. How are you?
Hi.
Good to see you.
I'm doing well.
Good.
Thank you. Thank you for joining us. Ms. Ana, do you have any updates for us?
No, ma'am, I don't have any updates.
Okay, got it. Thank you. And I don't see anybody else that I didn't. I see Brianna has joined us. Welcome. But that's about it. Okay. Alrighty, then moving on to our community presentation. That way, so that it wasn't going to be short, we had some form of education, and I asked Mr. Hernandez to be able to present to us for 10-15 minutes, and if we have any questions, we can go ahead and ask him those questions. But Mr. Hernandez, the floor is yours.
All right. Well, thank you. And what I'm going to do is I'm going to email this whole presentation after I finish to the list, so everybody has it. Now it's going to be longer than what I'm going to present, but this is part of a training that I do on co-occurring issues and how to provide treatment for it. So, you know, the question is, what came first, the chicken or the egg? You know, what came first, the substance use issues or the mental health issues? Which came first? And typically, substance use doesn't happen in a vacuum, and you're going to find that mental health issues typically are their primary and they need to be treated. Back in the day when I first started in the 80s, 88, this is called dual diagnosis. And we had a problem for many years treating dual diagnosis because the agencies that provided services, whether it was back then the Laredo State Center, and the Laredo State Center actually had the mental health services, but also substance use services. But once it split up, and Laredo State Center, which eventually turned into Border Region Community Health Center, and the nonprofits started taking over the substance use treatment. What would happen is that you had somebody would go to, let's say, SCAN or AMA or Staccato, and they would present themselves with a substance use disorder, but they also had a mental health disorder. So then they would be sent to Border Region Community Health Center, and they said, now you have substance use disorder, we can't treat you here either, so you have to go back and forth. And the clients would go back and forth sometimes multiple times. And in the early 2000s, the state mandated that community behavioral health centers needed to treat co-occurring psychiatric substance use disorders. And the process began also to integrate services between the substance use providers and the mental health providers through a program called COPS-D, which was for co-occurring psychiatric substance use disorders to provide some case management and counseling services, whether you were either in a substance abuse program or the behavioral health program. And so these type of services have started, and there's certain models that are very effective to treat co-occurring psychiatric substance use disorders. It's actually tip 42, treatment improvement protocol from SAMHSA. You can download that, put it on your desktop, and it tells you how to treat what co-occurring issues are and what PTSD is. So that's what we're going to go over today. Just a brief description of what it is. We're not going to go into the treatment because that would take too long. So how can I move this? And now it's not the.
Try to do the space bar, maybe.
There it is. Okay, so here it is. I did it. Okay, so this is just an idea of how it's important for us to work in the community. The consumer and family, when we're working with people with co-occurring psychiatric substance use disorders, the community has to be able to work together, and a consumer and their family need to be able to access services at whatever entry point, whether it is a justice system or whether it is SCAN or the food bank. If there's anybody that presents themselves with issues, they can start off on this wheel anywhere and end up at the right services. So let's say someone goes to social services like the food bank or Bethany House, and it's and they feel that there's something there. They can enter the wheel and eventually get to the providers that actually provide these services, which are on top: AMA, Pillar, Border Region Community Health Center, SCAN, West Care, if they're still here in Laredo. And but they should be able to enter the wheel and through the referral process, get the right services, right? So there should be no wrong way for somebody to access services. So for example, an adolescent goes to SCAN, and SCAN finds out that maybe parents have some problems. They can actually treat them there, but they can also refer them to Border Region Community Health Center, and the clients are being treated comprehensively. Right, that's what we want. We want to be able to have integrated, comprehensive treatment of people with co-occurring psychiatric substance disorders. We don't want people to fall through the cracks. Now, what are they? Individuals with co-occurring psychiatric substance disorders, people that both have a psychiatric or substance use issues. It used to be called dual diagnosis. It's individuals that have both a mental health disorder and a substance use disorder. And these are the individuals that more likely fall through the cracks because, it's easier to treat someone with a mental health issue than someone that has both issues. Now, in 33 years, I've never seen anyone that has come through my office that did not have a co-occurring psychiatric substance disorder. People use substances, but there's always a mental health issue that's primarily there. Effective treatment attends to the multiple needs of the individual, not just the substance use. So you have to go ahead and works towards developing an assessment, a comprehensive assessment that includes not only the mental health but substance use, and a treatment plan that's going to address those things. And over time, you address those things with evidence, science-based models. So this is what it looks like. This is where people with substance use disorders and people with mental disorders, they come into play. We obviously have people that have mental disorders, and that's all they have. There's a contention that people may just have a substance use disorder. I can let you know that I have not seen that, because what I do typically see is people may have a more moderate or severe substance use disorder with a mild mental disorder like ADHD or generalized anxiety disorder, but they still have the co-occurring issues. And so we're going to talk a little bit about that in a minute. According to the Journal of the American Medical Association, about 37% of all abusers and 53% of drug users also have at least one serious mental illness. Okay, and so we're talking about serious mental illness. We're talking about the less severe, like generalized anxiety disorder, adjustment disorders. You can have those issues and also use substances, and you're going to notice that there's different quadrants of care for those. Of all the people diagnosed as mentally ill, 29% have been diagnosed with either alcohol or drug use disorders. And so, but you got to remember that these are only the clients that have presented on social services. Now, what are the barriers that we've encountered when dealing with people with co-occurring disorders? And this is one reason why we're going to have a detox with a comprehensive assessment so we know how to integrate into services. Number one, drug and alcohol intoxication. If someone is intoxicated or under the influence of drugs, it's very hard to work with people. So we have to get them detox and get them prepared, and we have to work with them. Active drug and alcohol use. When you're having active drug and alcohol use, that's primary, and it's not going to go away. So even if somebody has a co-occurring issue, before we can treat anything, we have to stop the drug and alcohol use. Well, how do you do it? You stop it through a detox program and some maybe inpatient services where you treat both issues at the same time. So whenever we're going into our phase 2 model of a residential program, we're going to set it up to treat people with co-occurring psychiatric substance use disorders. And actually, when now you seek funding from the federal government for substance use, it has to provide treatment for co-occurring psychiatric substance disorders. It's no longer just treat substance use. It's both. Lack of family support, homelessness. We have a lot of homeless people that have co-occurring issues, lack of knowledge, cultural issues. So we have a lot of education to continue to do in the community, and we have the cultural issues of people being, in our own culture, going out and reaching to a mental health provider, a substance provider is a big issue. They're afraid on many different levels. So that's why it's so important to continue educating our community, and that's what our workshops with prevention and education. Those groups, they have to find a way to disseminate information about how these services that are offered in different agencies like SCAN and Pillar, Border Region Community Health Center can actually be a benefit for them. Lack of treatment resources. Laredo, I was listening to Dr. Ricky the other day, and he was talking about how we are the bastard child of the COVID. Well, I have used that term many times about we're the bastard child for mental health and substance use resources. We do not get the resources that other people, other communities our size get. And we have to actively work. We're blessed with what we have, but I can let you know, but it took us a long time. We had certain funding level at 88, and it completely went down. I mean, it wasn't for the people at SCAN or the people at Pillar or the people at Webb County, or the city of Laredo that have applied for these grants, we wouldn't be where we're at. We still have a long way to go. We're still underserviced. We don't have the number of mental health professionals that we need to have in the community. We have maybe 2.5 practicing psychiatrists in private practice. That's not enough for a community our size. We have a number of private psychotherapists, and so we have lack of treatment resources. Then there's the unwillingness for people to access services. There's different stages of change that people go through when they experience health, mental health, substance use issues, and when you're in a stage of pre-contemplation or denial, you're not going to want to go into services. So we have to find ways to link them into services to provide the science-based type of treatment or services to move them from pre-contemplation to action. And there's things that we can do to do that. And that's in later on in this presentation that I'll explain. Basically what happens is that people with co-occurring issues have multiple system utilization. They go to ER, substance use treatment, housing, psychiatric hospitals, jail, employment, but they don't get anything. And we spend a lot of money in our communities getting them these services. You know, the ER is a lot of times overrun with people that have substance use issues or mental health issues. They cannot handle them. Jails are overrun, you know, with these issues. People don't have employment, housing. It's overwhelming. You know, we have all of these issues that that people with co-occurring issues are utilizing, and if they're not all working together, all integrated, then it's not working. Now, I can let you know that back about 6 years ago, I wrote a grant for the city of Laredo to integrate services, not only co-occurring psychiatric substance use, but also HIV services. And it was a grant that was under the auspices of the city of Laredo. I wrote that grant. I was the evaluator for the grant. It was very, very successful. Okay, but that was just a grant as far as the implementation. It was just an initial grant to see if this type of integration would work. There was only about 13 programs in the United States that got this, and it was to see if integration could actually be successful. And we proved that it was. It was a very great program. I do know that Pillar has continued to work in their grants with integration. I know that SCAN has always integrated, but we did have a grant that showed that integration of co-occurring services, including HIV, was possible and all housed in the same place. These are the 4 quadrants of care, and this is like I'm saying, people with substance use and mental health disorders, I've never met anyone that didn't have a co-occurring issue. So you have quadrant 1, the less severe mental disorders, less severe substance use disorders. Those people, you know, it could be that they may have a stress-related disorder, anxiety. They may be using, and I'm not minimizing the use of cannabis, but you know, compared to heroin, cannabis is more of a less severe substance use disorder, right? And people may have quadrant 2, more severe mental disorders and less severe substance use disorders. So you may have people that are bipolar and they may be using some substances, but they primarily have bipolar. They may have schizophrenia. Then they have the less severe mental disorders, like maybe anxiety, ADHD, adjustment disorder, but very severe substance use disorders, you know, where the people are using cocaine, heroin. And then you have quadrant 4, more severe mental disorders, more severe substance use disorders. In the 3 programs that I evaluate right now, I do 2 for the county and one for Pillar. I do the Webb County Drug Court. I do the Judge Balomo's Veterans Court, and then I do the Pillar TCE HIV program. The clients that we see coming into the program are quadrant 4 clients, more severe mental disorders, more severe substance use disorders. And the reason is that they're coming in like this is because we do not have a residential program or services to treat the substance use. We don't have the capacity to treat all the very severe mental disorders. All these people are coming into outpatient services, and it's overwhelming the system. It can break the system. It's almost like, if you can imagine what's been going on the last year with the COVID, where the emergency room has been overrun, the hospitals have been overrun because of COVID cases. This is what's going on in our substance use treatment centers, and I'm sure SCAN can attest to it, I'm sure Pillar can attest to it, and our behavioral health providers like Pillar and SCAN and Board of Regional Community Health Center, they're being overrun, right? And this is what we see most of the time. So how do you treat this? Less severe mental disorders, less severe substance use disorders, they basically are primary health care settings. They can be outpatient. A lot of these are the people that come to me Although I see all different quadrants, as a matter of fact, I do a lot of quadrant 4 clients because I specialize in working with PTSD and personality disorder and co-occurring issues. I see a lot of quadrant 4 clients. But, less severe cases can be seen in the community. More severe mental disorder, less severe substance use disorder, the locus of care needs to be primarily the mental health system. But when you have more severe mental disorder, less severe substance use disorder, yeah, okay, it's going to be treated at Border Region Community Health Center, but there's an understanding there has to be a treatment for co-occurring psychiatric and substance use disorder. And they work together with the substance use provider. But it's primarily the locus of care is the mental health system. Less severe mental disorder, more severe substance use, the locus of care should be the substance use system. So those are like if they go into SCAN's residential program or their outpatient program, but they all know that they have co-occurring issues, so they're probably in the COPS-D program for case management, and they're working with Border Region Community Health. Unfortunately, the more severe mental disorders, more severe substance use disorders, the locus of care a lot of times tends to be state hospitals, jails, prison, emergency rooms. We want to get it out of that point, and the only way we can get it out of there is by building an infrastructure in our community where we can take care of our people. And so that's where we are at right now. We're at the inception of building up this network of care where we can treat these people that are overwhelming our outpatient numbers. I mean, it's, today I was doing supervision, and just in the Webb County Drug Court program, we have, let's see, I had it right here with me. We have, let's see, where is it? I just don't want to take a guess. I had the actual number. We have 19 and 50. We have 4, it's 15 and 16. We have 31 people out of town in residential treatment because we don't have the capacity here in Rehab. So in other words, they come in the drug court program, they qualify for services, but they're quadrant 4 clients. And so because we don't want anything to happen to them, they have to be referred to an appropriate level of care. So they're being referred to residential. So we have all these people out of town because we don't have any services here. And they stay in the jails because we don't have a place to detox. So that's what our work groups, that's what we're doing in this drug and alcohol committee, creating that type of space. Now, what is it that we see? We see obviously depression, mood disorder spectrum, including bipolar disorder. All of that can be treated. We have anxiety disorders, generalized anxiety, panic, obsessive compulsive, phobias. We can work with schizophrenics if they're stabilized with medication. Now, if they're not stabilized, then they have to be, the primary locus of care has to be the Border Region Community Health Center, but they can, once they're stabilized, they can be treated in an integrative fashion. We have to move, and as we move along to develop into phase 2 in the residential facilities, we have to move for our community to understand the importance of integrative mental health and substance use healthcare services. Not doing it alone. We have to learn from what we did with the city of Laredo for 5 years, how we provided integrative care, what we're doing with some of the SAMHSA grants, where we're having like the drug court, the veterans court, and Pillar. They have a one-stop shop where everything can be done. I believe SCAN has the same thing. And so we have to move towards that direction where we provide integrated care and we have better communication amongst the agencies. So I'm going to stop here because then we're really going to stop. We talked about clinical disorders, and that's a whole section on clinical disorders, but I'm going to be happy to go ahead and send this out to everybody. Okay? Any questions?
That was a very informative presentation. Thank you, Mr. Hernandez. I know I was taking notes, and every time that I would put like a little question mark to ask you, you were answering right after. So I appreciate that. I know that this information is very good as I'm writing down the part of the different, you covered different things on the work group. So I'm hoping that I'm able to call some of the members and ensure that what we're part of our work group, that we're actually doing something, and the information that you provided is going to be of good use. So thank you for that.
Okay, you're very welcome. And anytime you need any information, there's so many different trainings that like I'm in a 6-week process of doing all of Pillar's training. So I have lots of different trainings, and if you ever need anything, I'd be happy to present.
Well, as a matter of fact, Mr. Hernandez, since you just mentioned that, I'm just curious. We currently have the work groups where it's prevention, outreach, education, intervention, treatment, rehabilitation, detox, transitional support, transition, and aftercare, which from a while back, we had discussed that those were the groups that we were much needed and in transition to one another. Do you feel that we are missing a work group or that we need to put in something else into one of those work groups?
Yeah, I think last time I mentioned that we have to have a work group on mental health and co-occurring issues. And in that particular work group, we have to start having a discussion on integrated services for the population that we're going to be looking at, which has co-occurring psychiatric and substance use disorder. So yeah, mental health and co-occurring psychiatric and substance use disorder should be a work group with a focus being, let's figure out how we can move to integrated care eventually. Because without integrated care, and the model that the city had was pretty good. It was the city got the grant, and there were city employees. Some of them were city employees, and they were all stationed at Pillar. And at Pillar, there was offices for Board of Region Community Health Center. There was services for HIV. There was a combination of counselors, the licensed professional counselors were from Pillar. So there was a combination of staff from Pillar, the city of Laredo. And so in other words, if somebody had to go in there that was, let's say, at risk for HIV, and they go in and they have their HIV test done there. At that time, they're screened for other issues that they're already at risk, higher risk for substance disorders and mental health disorders. But when they're screened, if they qualified for the program, then we could let them know, hey, we also have these services here, whether it's mental health services alone or substance use services or the different quadrants. Typically, it was all the quadrants. It was just in one place. And that's what we want to do. We want to make it easy for our population. Whatever agency is doing this, and since we're talking about this as part of this particular program, we can talk about integration within one program, but integration, like we talked about in the original wheel, where everybody is communicating and working together. That's what we want to strive for, where all the community stakeholders. I mean, we have a good group of stakeholders here, but let me just go to one slide. We don't. This is not.
Go to slide 2.
Let's see. I have to go to slide. This is this is it.
2.
Okay, there. Okay, so it's slide 2 here. So we're here, and I know that Board of Region is here, SCAN is here. I know that Pillar sometimes is here, sometimes not. I know Alma is here sometimes. And we may have representatives from the justice system. I know that Paul's here at times. But we need to be able to have all of these people working together so that we can move towards eventually integrated care. What is the system going to look like if someone is at the university and needs support from more intense services than the counseling department can do there with Dr. Memo Gonzalez? I mean, they can do the best they can, but they're going to be seeing people with co-occurring issues. What do they do? What happens to housing services when someone shows up to there and they need people? And I do believe we have people from housing in our group. So I believe we need to have all of these people in part of our group. That's just what.
Okay. Got it. And I wrote it down. So do you think it should be a separate group, or should it be integrated to either intervention, treatment, rehabilitation?
It needs to be a separate group, because prevention, intervention, rehabilitation can all be looked at independently. But I think then this piece of the puzzle can help them come in, and then we can begin working more as an integrated group. I think there's a need for education prevention, I think there's a need for intervention. I think there's a need for all the different things that you mentioned, rehabilitation. Those are specific, but then the idea that I have is that if we put in mental health and co-occurring psychiatric and substance disorders with a focus being on integration, then that group eventually will become a primary focus and people will integrate towards that and we can all discuss things. Because, it's one thing for when SCAN is doing primary prevention, that's important. And we have to do primary prevention to our community. And yes, if they're doing primary prevention and someone presents themselves with, hey, my dad has this issue, then we have to be able to link them up. But I think the end game is let's keep our work groups the same, but let's work towards integration even within our own with our own work groups, but let's just start talking about mental health because we have not talked about mental health and we have not talked about co-occurring issues until today. I mean, I have maybe have mentioned it, but I think that's just, I think just having a group by itself for right now is okay.
Okay.
Start looking at how we could do it.
Definitely. So I've already noted it down. And when I send out the email for the reminders of the work groups, and if there aren't any changes, maybe somebody can come into the mental health co-occurring group. And as a matter of fact,
and I want to be in that group, so just to let you know.
Okay. Yes, most definitely. And you'll probably lead it because I do have members, like stakeholder members, like Ms. Ramirez, Ms. Carrillo. I see Ms. Guerrero, Ms. Perez, and a couple of them. And so we just want to make sure that, they're able to assist and be part of it. And as a matter of fact, if you have any suggestions for anybody from outside this group that you might want to consider being part of that group to assist you in providing more information and creating that integration, I think it'd be a wonderful idea to do so. So thank you very much. Does anybody have any questions for Mr. Hernandez? Okay. All righty. Well, then thank you again, Jesse, for actually doing this brief presentation. I know there's so much to it, and I'd love to have the opportunity that whenever we meet that there is a form of education to all the members. So if any of the members know somebody that might have a wealth of knowledge that might be able to provide us more insight on their work and what we're doing, I think it would be a great thing to recommend them as this will be part of our agenda so that we can, again, ongoing education. The more that we know, the better that it is. So thank you very much. We're going to go ahead and continue as part of our agenda. If we have any announcements, do we have any announcements from any of our members?
Colleen, I have an announcement. I
Yes.
did review the commissioner's appointee, and I did get with one of the commissioners to see if there was a way we could substitute one of his appointees for Marina, and he was just going to, out of courtesy, make a call to who he appointed. And if everything's okay, I recommended that he appoint Marina as a member. So I'll keep you all updated on that.
Yes, thank you. And as a matter of fact, that's what I was going to ask you as far as announcements. We do have a couple of people. Andrea did send out the attendance sheet. So I will send it out to you all so that you all can review and look at your own attendance. But I do know that there are a couple of vacancies with the city of Laredo. So if anybody knows anybody, I think they should recommend that they contact their council member for appointment. That way, I guess the more that we are, the better that we are able to tackle this issue in our community. So thank you, Mara, for actually asking in regards to that. I know Ms. Moreno has been part of our group for a while now, and she's very active, and her attendance is sometimes required for quorum. So I think she would be a great asset to being part of the commission. So thank you very much on that. On that note, also, I did receive a note from Judge Tano Tijerina, and he was congratulating me on the appointment as chair for the commission. So I wanted to put that on record, that he did send a congratulations. So I do appreciate that. It was actually a motivation for me. So let him know, Mara. And then also, Andrea had mentioned that while Paola is going to be doing the minutes, it was recommended that part of our bylaws do state that we should have a secretary. We haven't actually appointed a secretary. So that might be something that if anybody is interested in the position of secretary, please let us know, because that would help Paola and the commission to maintain the minutes. The secretary does require to be in attendance for the majority of the minutes, or the meetings, I'm sorry. So if anybody's interested, please let us know. And then of course we discussed the attendance and the vacancies, and the bylaws will be sent to you guys just as a review for what we're doing. I think it would only be just that Ms. Quintanilla was always on time. COVID. I know things are going to be changing in the next couple of weeks, but the problem has not decreased. I think it actually has increased in our community. So we need to be prepared to be able to tackle it. With regards to National Drug and Alcohol Facts Week, there is some things that I'm going to be doing on behalf of the Drug and Alcohol Commission with the schools. I will be sending out a flyer just to kind of allow teachers to be able to Q&A their students and learn more about drug facts. And I'll go ahead and give you an update on that and survey afterwards for the next meeting. But are there any other announcements from anybody?
Yeah, I'd like to, in light of everything that's going on, and I think you hit the nail right on the head, Colleen, I'm more than happy to share or host any type of virtual meeting, whether it's a work group. By all means, I highly recommend, as the representative from the health department, I highly recommend that we continue the virtual meetings in this type of setting. So, it's my work groups. So you all feel free to send me an email and ask.
Much, Mr. Walls, and I have a Zoom account that's paid for and a GoToMeeting account. So if anybody ever wants to meet outside those meeting via web, you're more than welcome to utilize them. So thank you very much for that. Alrighty. Well, Paola, how did you do this meeting?
Surviving, trying to keep up with everyone. Good thing it's recorded. I can always go back.
Okay, great. Just wanted to make sure you did good.
Yes, thank God that's here with me. I asked her to come to stay with me for today, just to get my feet wet. But yes, I'm surviving. Thank you, Colleen.
All right, just wanted to make sure that I mentioned the names again and again, and as you're trying to get acquainted with everyone's name and who's who. But thank you very much again, Andrea. You'll be getting something on behalf of the commission, and I will drop that off early next week. Thank you again for all the things that you've done for our commission and being on top of all of us. So we appreciate that. If there are no other announcements, I will go ahead and ask for adjournment. It is currently 6:18. Do I have a motion to adjourn?
Yes, you do. I just send the PowerPoint, so everybody should be getting the PowerPoint. You'll get a PowerPoint. It's an extended one, and maybe later on we'll talk about different things. But I do say let's adjourn.
All right. Thank you so much, Jesse.
Second.
Who is that?
Second. Guillermo.
Mr. Walls. Mr. Walls, I don't think you can adjourn. I think it needs to be a commission member. Can I have a commission member adjourn?
Can't.
Was that Mara?
Yes.
Okay, perfect. All right. I have a first by Jesse and a second by Mara. All in favor to adjourn the meeting?
Aye.
Any opposed? All right. We'll see you next time. We appreciate you coming in and doing the best that you can do for our community. We'll be in touch, and hopefully we'll see you all next time.